Welcome, Dr. Roosevelt Smith and Dr. Clifton Hayes.
Thank you very much.
Thank you very much.
So what is peripheral neuropathy?
Sure. Peripheral neuropathy is where the nerves of the body are damaged and there is a miscommunication between the brain and the periphery of the nerves. The periphery is a further part of the body, like your hands and your feet. So somewhere the nerves are damaged and you're not getting the communication like it's supposed to be occurring.
Because probably to make it, there's two parts of your nervous system. You have the central nervous system, you have the peripheral nervous system. The peripheral nervous system deals with all the nerves that are outside of your body, and you got to imagine the nerves that are probably the furthest outside of your body going from your hands and your feet. So what happens is when peripheral nerve damage happens, it's a result of a lot of different causes. Probably some of the more popular ones are neuropathy, medical interactions, negative interactions with medication. Some people get it from chemotherapy. Some people just get it just for no reason at all. They get peripheral neuropathy. But overall, what happens is those nerves become damaged. And the way those nerves become damaged is that for some reason your brain senses that it's getting a pain signal. So since your brain gets that pain signal, what it does is it stops sending the large amounts of blood to your peripheral nerves, which is usually your hands and your feet. But what happens is as your body just starts decreasing the amount of blood volume going to those areas, because you have to understand, nerves need two things, oxygen and nutrition. And the blood provides oxygen and nutrition. And since they don't get that oxygen and nutrition, what happens is that since your brain's getting that pain message, it reduces that amount of blood going to those nerves. So what happens is those nerves, unfortunately, start to become damaged. And that damage usually leads them not to perform the way they should. So what happens is people get burning sensations, pain, tingling, numbness, and a whole host of other sensations. But what ends up happening is that, for whatever reason, those nerves just start to become damaged and die.
So tell us a little bit about yourselves and how your office deals with the peripheral neuropathy treatments.
Well, we are wellness experts. We've basically put a practice together that's been taking care of physical ailments first. And that was tied into nerve damage. This is what we've seen for years. So those nerve damages, that people have looked for all kinds of answers to repairing those nerves. They've tried medication, they've tried nutritionals, they've tried various therapies, but there hasn't been anything that we've seen that can help repair nerves over long term. Lately, the scientific studies have shown that nerves will regenerate, but it's taking a long period of time to do so. So what we were searching for is a program that would allow those nerves to heal quickly, and you want to do it so they can stay repaired long term, so you don't have to keep doing things over and over to try and repair the nerves. So our program is basically based on repairing those damaged nerves and helping the body heal like it's supposed to.
And probably the best way of doing that is that we use a special patented machine. It's called the Tesla Max. Along with the Tesla Max, we also help people fix the way they're eating nutritionally. Nothing crazy, but just more or less making better food choices. And also we provide some nutritional supplements, not something crazy, but just enough stuff to help repair the nerves. And then more importantly, we also give them a rehab protocol. And that rehabilitation protocol is just that it's great to repair the nerves, it's great to get everything running and functioning again, but it's more importantly to get the muscles and the nerves working back together. So we kind of add those four parts and make it a synergistic program so we get the best success for each patient.
And what are some things a patient could expect from the Tesla Max?
Probably the biggest thing is the Tesla Max is that usually when we do that therapy is that initially what they're going to notice is that they're going to get a relief of pain. Because usually on a pain scale, most people are anywhere between a 9 to a 10 and sometimes greater. And what our goal is to do is gradually over time get those pain scales down and get it reduced. And the first thing is reducing pain levels. But for some people, pain is not an issue. For some people, it's that they have numbness. And for those people, our goal is to get them to where they're starting to feel things again and getting sensation. So whatever the problem is, that's what we're focusing on first, their main issue.
I'll go back to some of the causes of peripheral neuropathy. Some of the causes that we've seen walking in the office are people that are suffering with diabetes. And diabetes right now is an epidemic. You can see how the nation right now is overweight, and we're seeing sugar issues affecting not only people's weight, but going back to damage of those nerves as well. So if you can't get those sugar issues under control, people will continue to have the neuropathy issues. So that's why our program addresses the person as a whole, not just dealing with the primary complaint that they're coming in, but to make sure that we address that long term so we don't have issues in the future.
Yeah, and because probably the biggest thing with diabetes, and even though diabetes is the most popular one, it's not the only one.
The only one.
But the thing is, though, a lot of people think, well, I'm not overweight, so I'm not a candidate for diabetes, which is actually a misnomer.
That's a mistake. That's right.
Because what happens is that diabetes doesn't attack people with a certain weight. It's not like you get to 250, 260, and boom, you get it. Or you're 30% over body weight, you get it. Unfortunately, diabetes is a result. Diabetes causes a lot of malfunctions in your body. And it doesn't matter what your weight is or how you look like or what age you are. Once it happens, it happens.
That's why we're seeing this damage happening to people younger and younger. Before, peripheral neuropathy was more prevalent in the older generation, but now we're seeing people anywhere from ages 24 all the way to 65 or plus that are having the damage to their nerves. One of the other things that we see often in the office is people coming from chemotherapy treatment. So patients have already gone through all the cancer treatments, and they're usually cancer-free, which is encouraging, but now they have other symptoms. They're unable to feel their feet. They're having burning and numbness in their hands. They can't sleep anymore. So that's another big population that we see coming in for the treatment. Another population that we're also seeing is traumatic damage. So people that are standing on their feet all day or sitting at jobs that require set positions for extended periods of time. Accidents can cause this. We've seen people that have been in work accidents, also people that have been in auto accidents. And again, if those nerves aren't healed properly, that damage will continue over time, and they start getting the myriad of symptoms that we'll see coming in the office.
Wow, so basically it could happen to anyone.
Pretty much, that's true.
So if a patient recognizes these symptoms in themselves, what's the first step you recommend them to do?
Usually, you're going to see your primary care physician. And what happens is, because you're going to come in and complain, hey, my feet, everything else is great, but my feet are having problems, or my hands are having problems. And usually what happens is your next step will probably see a neurologist, and he'll probably run a test called an NCV. And what happens is you run an NCV test, it'll tell you that you have decreased sensation in your nerves, in your nerve endings, which is, unfortunately, it's a negative thing. And usually what happens is people go through a battery of medications, and unfortunately, you got to understand, a lot of the medications are not geared at fixing your neuropathy. Because what happens is that when you're taking a lot of these medications, you're either desensitizing the sensation, and over time, your body builds a tolerance to it. So after a while, no matter how many doses you take, it never gets corrected. So what happens is that usually the people who are coming in our office, they've been diagnosed already with it, and they're usually on some type of, gabapentin, Lyrica, and there's a host of them. And unfortunately, for a lot of people, it's just not getting any better.
And the trouble with these medications is they're usually anti-seizure medications because we're dealing with nerves. So when a nerve is damaged, it's that communication. Again, the brain's got to talk to the body. We already talked about the central and peripheral nervous system. So that brain has got to talk to the different parts of the body. And if there's a miscue somewhere in there, that's the problem. So what the medications do is they basically block a lot of those pathways. So people that have peripheral neuropathy, they block the pathways, but then they can't function normally. They're unable to reach like they expect to or able to hold things. We had also talked about at one time about people driving. They can't feel the gas or they can't feel the brake. When that occurs, it's very dangerous now for these people to be out on the roads.
Yeah. So your average patient with peripheral neuropathy, what's that experience like for them?
Probably the thing you're going to notice is that a lot of them are going to have a really difficult time walking. More importantly, they're going to have a more difficult time. For a lot of people, they can't sleep normally. Insomnia is a real big thing for them. And unfortunately, you got to understand, if you're in constant pain, you're unable to do things, you're going to be angry. And people are just, you're not just going to get a sunny disposition all the time. And then more importantly, you're going to have people who just more or less can't function around normal family functions. I mean, imagine you're a grandfather and your big thing is you want to hold your grandchild, but you can't stand on your own feet.
Right. Or you can't feel them to pick them up.
Yeah. Or what's even worse is that, And actually, you not being able to feel your feet, if you're an elderly person, you live by yourself, your kids live out of town, now you've become an invalid and you're more or less a shut-in because you can't drive down the road anymore. Because now you're trying to guesstimate. I mean, we've had patients who've gotten into car accidents because they think they're pressing down the gas pedal and they're not even touching the brake.
They've driven through a front of a restaurant.
Yeah. I mean, we have one guy drive into a cemetery. We've had a couple of things. And there are some people who are under the impression, well, I can gauge. I'm thinking it's really tough to gauge when you can't feel. And then walking down this, and then some people, they can't even walk walk barefooted. Imagine not being able to walk in your house barefooted.
Wow.
You know, I mean, I had one gentleman, he had a size 11 foot, but he had so many foot pads and so much foam in his feet. He almost had to like pack his foot in like almost cotton so he could walk. So he was wearing size 14 shoes and his foot was 11 just to get everything in there so he could walk but not have the incredible pain.
Wow. And that lifestyle, it just seems so scary and uncomfortable, right?
Well, people are looking. So when you get to that point, people are looking for answers. Like you said, they've been to the primary care. They've usually gone further than that. They've gone to their neurologist, and they're looking for answers. The answers that are out there right now are usually medications and injections. And like we talked about before, that's not an answer. So that's where we got together and said, hey, there's got to be a better way to do this. So I'll push that into how we created this program. We got the Tesla Max machine, and it is a patented machine. We're one of the only clinics in North Carolina. I'm not sure if there is another clinic in North Carolina that has this. So we searched for years, and we've done clinical trials with our patients to determine how well we could help this problem. And we've seen great results. That's the encouraging part, and that's one of the reasons that we wanted to put this program out there, so people know that there is another alternative to getting this problem taken care of.
Because there's a lot of opportunities out there, and you got to understand what we're looking for is our method 100%? No, there's nothing 100%. But this is the best thing that we found that helps people, because there's some people say, hey, I can fix your neuropathy with nutrition. That's great, but we're not comfortable telling people that. More importantly, there's another treatment out there with laser therapy. Laser therapy, there's pros and cons about it, and we have lasers in our office, but probably the biggest con about it is that, number one, you kind of have to pick and choose the type of neuropathies that you handle. And usually that becomes kind of dicey and saying, well, I can handle this one, I can't handle this one, and it becomes like a picking, like an eeny, meeny, miny, mo. And that to me isn't really, that's more of a guessing game.
Right.
And as far as with the Tesla Max, we've helped people with chemotherapy. We've helped people with diabetes. We've helped the idiopathic ones. Those are the people who just come in with it. We helped the people with chemical I've had one patient who came with neuropathy. When he was in the military, a chemical fell on his feet, fell on his boots, and after he came back, now he has neuropathy. I mean, there's so many different ways to go about doing it, and for us, that we found the Tesla Max provides the best answer for every single type of neuropathy or cause of neuropathy there is. And that's why, and for people for our diabetics, fixing neuropathy is only one part of the problem. Changing your nutrition is the other part of the problem, because you got to understand your body is a whole organism. So you just can't fix the feet and then let you go back to eating Twinkies and Ho-Hos and eating a poor diet. We got to change the way you're eating. And then by changing the way you're eating, it's going to help your body's overall nutrition and respond and help and can repair those nerves. And then we give you supplements that help you repair those nerves, and then give you a rehab program to strengthen the muscles so they can work back with the nerves and get everything working again.
But let's talk about repairing the nerves, because when you talk about repairing the nerves need two things to repair, right? And that's oxygen and, well, three things, I guess we want to do it that way. Proper nutrition and activation, right? Well, that's still two. We're looking at oxygen and activation. So with our program, you need to give it the oxygen nutrition that it needs. And the only way to get that is through muscular contractions. So we sort of talked about muscular contractions before. A lot of the therapies out there can do muscular contractions, but the feeling to the patient is very uncomfortable. We've seen patients coming from other clinics that have tried other electrical therapies, and they just haven't been able to get the response because it's painful. Well, the advantage with this treatment is it is not painful and very comfortable for the patients to go through this treatment, and they're able to take it home. So we touched a little bit before on how they can take this program home and get twice or 10 times the treatment they could get ever going to the doctor's office. So you're getting better results, more treatment, and it's more comfortable for you too. So that's a huge advantage to this program.
So it's a portable system that they can actually take home with them.
And that's the added benefit of it, because normally you want them to do it at home, because the way this machine works is that you have to do it at home. You have to do it twice a day, every day. And by being able to take it home, that allows you to do the therapy twice a day, every day. Because realistically, you're not going to come to our office twice a day.
No one is going to the doctor's office. Even going 2-3 times a week, you're just not going to receive the results that you'd see with this take-home program. It has been very impressive to see people going from once or twice a month getting injections to try and to feel better, to going through this program, and then being able to walk, play with their kids, get back to the lifestyle that they were looking at that they never thought they would see again. So it's encouraging to see that.
Yeah, those are some pretty impressive results, that they can go from not feeling their feet to walking again. That's amazing.
Right. And when you go with the balance and everything, we'd sort of talked about seniors before. Seniors now, their biggest cause of mortality is from falls. And when you lose the conduct to your feet, when you can't feel your feet, you're more likely to fall or stumble. So we see many patients coming to our offices on walkers or on canes. So their stability issues are huge. And that's with our program. We've addressed a lot of that training and rehab that Dr. Smith had already talked about as well, that there is a component to help them regain that balance once they do feel their feet again. So it is very comprehensive. It's not just one little piece. And that, I think, is what a lot of patients have been missing. They look for one little piece, and they may or may not get results, and then they get frustrated because they have to go to the next doctor, and the next doctor will try and give them the one little piece. But we've put this all together as a complete program so people can go from A to Z and get it taken care of.
Right. And you'll be there the entire way with them.
You have to. You have to. Because we have to make sure, and probably the biggest thing is that we do bi-weekly follow-ups, simply for the fact that, to make sure that people are using the machine properly, to make sure everything's going properly, to make sure they're doing the nutrition, and kind of to hold everyone accountable. Because probably the biggest thing is that we're really vested in your success with our patient's success with the program.
And we have done that too, because there are some people that cannot make it out. We've had people drive 3-4 hours to come get the machine. So it's a difficult time to come and talk to the doctor, but we have ways set up that we can speak with the patients and update them that they don't have to always travel to get it taken care of, but we'll still spend the time to make sure that they understand the program and are getting the results that we expect. So
that's great. That's great. It's great that there's so much hope in this therapy system.
Well, probably the biggest thing is that the reason why before we even give the machine out, we usually have people come in for the first consultation. We have them doing an initial treatment. And the reason why we have them do that initial treatment is that, number one, we want to make sure that it works. And when I say by works is that we're not trying to fix it all in one visit, because that's realistically is not going to happen. But what it is going to do is going to give us the opportunity to see if we can make a positive change. And if we can see a positive change from you doing the therapy, that goes a long way. Because if you're coming at a person who has a pain scale over 10, or they can't feel their feet, and we do one treatment, and now you're able to feel your feet, or the pain level's gone down, that's really positive. Because you got to understand, you have people with debilitating metabolic disorder that if you can more or less fix it for like maybe 10 seconds, 30 minutes a day. I mean, we've had some people do as well as 3 days with a significant improvement for just one treatment. That usually is a really good sign that this is something that's going to help you out.
Well, and there are plenty of people that have come in for the consultation and evaluation. After we run through that evaluation and do the treatment for them, they'd come and say, this is the first time I've felt my feet in years, or this is the first time I haven't had burning in months.
So what are some of the success stories that you've had with the procedure?
Well, some of the people that have come in, one of the greatest things is, like we talked about, an older gentleman before that couldn't play with his grandkids. So for the fact he went through the treatment, was able to walk and get off the walker and then again be able to play with the grandkids. We've talked about some safety issues for the walking and falling. A lot of our patients were on walkers or they were using canes, and after going through the procedures, they were able to get off the walkers and get off the canes. And that's huge because that's a safety issue, not only a lifestyle issue. So that's been exciting. There's other people that have suffered with the cancer patients, and they were unable to sleep, and they couldn't keep the covers over their feet, so they're able to sleep again. And that makes you much more pleasant when you're able to sleep and be functional again.
Yeah, absolutely.
Sure.
And so what would the patients expect coming in on their first appointment?
Well, what people need to do now is they need to call one of the offices. The advantage for us is we have 4 locations throughout the Triad, so we're convenient for most people. You call the number, and the office will go through a questionnaire to basically see if you're a good candidate. Like we talked about, this treatment is not a one cure for everyone. So we'll go through that questionnaire, which you'll answer on the phone, and then we'll schedule a time for you to sit down and talk with one of our doctors. After we go through the talk, we'll look at your medical records, and we do an evaluation. That evaluation consists of a nerve test, and again, it's not painful. That's the whole point of this. So the nerve test determines whether or not you're a candidate for this program. And if you are indeed a candidate, we'll give you your first treatment. After you go through the first treatment, then we'll put a plan together and determine where we need to go from there. So the best step now is to call the office and get you taken care of from there.
That's great. And I'm sure patients who have been experiencing so much pain will be happy to know that it's painless.
Absolutely.
Yes.
Absolutely. And that is a great response for this because people have done injections, which are painful. The medications are not blocking the pain. So any therapies that can offer you relief without pain is a win. That's a win.
Awesome. Well, thanks so much for coming in.
Absolutely.
Thanks.